You know, many of our colleagues are concerned about using cannabis in the geriatric population because of comorbidities, because of polypharmacy. But we also know that cannabis is being used widely by physicians for that very population, and the geriatric population is the largest expanding population of medical cannabis users. We know that cannabis is incredibly safe on its own, and we also know that it can be added very safely when properly dosed and titrated in conjunction with almost any other medication, especially when you're monitoring and you have an engaged patient population.
So it is a natural fit for the geriatric population. Seniors are 5 times more likely to have negative outcomes from adverse drug reactions because they're on so many medications. They're 3 times more likely to be on opiates. The fact that they're on opiates is an issue as well because they're more likely to have a negative outcome than someone who's not in the geriatric population. We see just some really compelling results in some of those nursing homes I practice in with that population. One of the biggest myths of that geriatric population, and it's a valid concern, would be falls. Are they at higher risk for falls being on cannabinoid therapy? And there's some literature out there that actually states they actually have a lower risk. You start lowering these medications, reducing these drug-to-drug interactions, and they're actually less likely to have falls. So I use it every day in that population, and we're seeing the benefits.
And I think some of the specifics, looking at patients with dementia who we'd normally steer clear of, there's some early research to show that, again, low dosing can decrease agitation and improve sleep in those patients. So those are all things that, from a family doctor perspective, might be useful, for them to know and understand about. But I mean, my oldest patient is 96 years old that I started on cannabis 3 years ago. She was wheelchair bound. She now can stand up. In fact, the first time she visited me after she'd started, she got up and danced in the room, and it was amazing to sort of see how somebody could get so much benefit from such a small dose of product. Yeah.